joined us from different LCs. I welcome you all, and we have gathered here for a walk through USMLE with famous USMLE advisor, Dr. Malk Asad. I am Alama Khan, the Vice President for Capacity Building at IFMSA SMC-LC. And with me, I have another co-host for today, Roj Khan, who is serving as a VPI in IFMSA SMC-LC. Roj, are you here?
Hi everyone, I'm Ruj Khagan, and I hope this session is very informative and we all get to learn a lot of stuff from it.
Thank you, Ruj. So before we start introducing our guest speaker, I would like to give a short briefing on IFMSA to all the new members who have joined us in this session. IFMSA stands for International Federation Medical Students Association, and currently it is established in 129 countries across the globe. And IFMSA SMC-LC is a local cabinet that got approved in 2020, and within 1 year, in 2021, it got upgraded from a candidate LC to a temporary LC because of the very hardworking team. I hope that we continue achieving milestones after milestones. Moving towards the introduction of our guest speaker, let's welcome Dr. Al-Assad, who is a very talented and very famous USMLE advisor, as well as a research fellow at MD Anderson Cancer Center. He is very inspirational and has millions of fans, millions of students across the globe. I personally am a fan. Sir, it's a great honor to have you here. And before I forget, I would like to congratulate you personally on the behalf of my whole team and all the students who are present in this session for being matched on top priority program. Thank you so much for being here, sir. Over to you.
Thank you so much for having me. It's an honor to be here. So just a quick introduction about myself. My name is Malk Asad. I'm originally from Syria. I went to medical school in Aleppo, and then I did 1 year of research at the Mayo Clinic in Rochester, Minnesota. And then I moved to MD Anderson, where I'm currently a research fellow. Before yesterday, on Friday, I majored into plastic surgery in my top choice at the University of Pittsburgh. So hopefully I'll start plastic surgery residency in July.
That's great. That's great. So, sir, we would like you to walk us through USMLE. How do you apply? Being the students of third world countries, we are always curious about what's going on in Europe and what's going on in America, and how do we get in that race. So we would like you to walk us through how we start our journey if we are an aspirant of USMLE.
Yeah, sure. This is, as you said, it's a very long journey. There's not always a lot of information regarding that, and so much conflicting information, especially regarding certain specialties. So the first thing that you need to do is to do your exams. So whenever you're applying, you want to do residency in the US, you need to do your exams, the step 1, the step 2, CK, previously step 2 CS, which is an exam you have to be in the US to be able to do. There are only 5 centers in the US where you can go and examine patients, do a physical exam on them, and they give you a score based on that. So that's canceled now. Now you only have step 1 and step 2 CK to be eligible for ECFMG certification, apply to the match. Step 3 is not needed, so forget about that now for the residency application. So the first thing is to register yourself with the ECFMG. There is some paperwork that you need to send from your school, or your school has to verify you. So all the information will be on the ECFMG website. And I'm starting a blog post to explain everything that I'm saying today in more details, show you the links. But it's easily identifiable on the ECFMG website. They explain to you how you can register for a step. Let's say you registered, your school verified you that you are a medical student, and you apply for the step 1. After you study for your step 1, you prepare, and I'll do in the coming weeks so many videos. I have a YouTube channel in my name, Malk Asad, that I post videos on, so you can follow that channel and you can see what are the resources that you need to study, how do you need to prepare for step 1, what do you need to do. There are so many information again online. just be careful about the resources, the time you have, because it's a very long exam, so many resources, and you might get overwhelmed. You might study 1,000 books, and at the end, only few are the real one that matter. So that's step one. After you finish your step one, you have to do your step two. By the way, there is no order for this, so you can do step one before step two before step one. It's up to you. Personally, I prefer to have this. I did step one before step two. For one reason is that step one builds the basics of medicine, how chemistry works, anatomy, physiology. So I recommend starting with step one. Previously, the step one score used to be the most important thing when you're applying to residency. It's a very, very important, especially for receiving interviews. Step one score is kind of the hallmark of all your applications. So that's why you need to take care of the score. Currently, or not currently, in June of 2022, January of 2022, so in 9 months from now, the USMLE is planning to do the step one pass fail. So there will be no score anymore. You only need to pass that exam. After I think this will happen, step two CK score will be more important. So don't say I'm just gonna pass this and then I'll focus, because so many ideas that are in step two CK are in step one. So if you prepare well for step one, you'll be better prepared for step two. It will take you less time, you'll get higher score. So step one score, step two score are important. American graduates don't have to do step two CK before they apply. And actually any graduate can just apply without anything. But the thing is, you won't get interviews. People want to see that you have done something. You have done step one, step two, CK. And personally, I prefer applicants even to have their ECFMG certificate by the time they apply. Because when programs, put yourself in the program shoes. There are 1,000 or maybe more, way more, 10,000 medical schools around the world. How can they know that this school is good, this school is not? By having this certificate, you're telling them I met the US criteria. So no matter what you think about my school, based on your criteria, these are my scores, this is my certificate, I'm ready to start residency. Because you cannot start residency without your ECFMG certificate. So if a program invites you for an interview without your certificate, how can they know that you'll get it? They think, oh, they might not, so it's risky, let's not invite that applicant for an interview. So to optimize your chances, step one, step two CK, and the certification. Previously, once you have step one, step two CS, you get your certificate. Now step two CS is cancelled. So ECFMG had to make different rules, and I make a specific video about the 6 pathways for ECFMG certification. So after you get your step one and step two CK, you do an exam called the OET exam, Occupational English Test. This is like a language exam with some medical terms and stuff. And after you pass that exam, you apply through one of the pathways. There are pathways, either you have a license to practice your own country, you passed a standardized exam in your school. There are certain schools that are directly certified. So make sure that you fit one of these pathways so you can apply when the time comes, you apply with your certificate. So this is the requirements for applying, the steps and the certification. What things that you need to do in order to optimize your chances of matching? Because if you have what is needed, that's not enough. Nobody's going to send you interviews with that alone. You need letters of recommendation. Letters of recommendation are documents that say, you know what, I've worked with this person, they are good, take them. So how can you get these letters of recommendation? Preferably, they have to be from the States, from the US. Don't get letters of recommendation from your own country, because people, again, don't trust them unless they are internationally well known. If you got your letter of recommendation from your own country, from a Nobel Prize laureate, yes, that's good, use it. But if it's like a doctor that nobody knows, it's not going to help you. Because people want to know that you have worked in the US and you are good there. The problem with the letters of recommendation, especially before, when CS was there, people used to get visa, come do CS, do some rotations, and get letters. Now it's harder because there's no CS, so you need something else to get the visa. You need to do rotations. There is something called elective. Elective is rotation where you do exactly the tasks that American medical students do. So you get to, if you're in surgery, you get to participate in surgery. If you're internal medicine, you can get to examine patients, write notes, have notes in your name in the medical records. So that's the advantage of electives versus observerships. Observership, you just observe. Imagine yourself a robot that can talk but cannot do anything. This is how observerships are. So electives have to be done prior to your graduation, which means you need to plan everything ahead, well ahead, because most schools require you that you have step one before you do your elective. So imagine you have to study for step one, finish step one, apply for the elective at least 3 to 6 months before that, finish the elective before you graduate. So it needs a lot of planning ahead. So make sure you do that, because electives are way better on your CV than observerships. So that's one. Clinical experience in the US through observerships or electives. And we can talk for hours. I'm going to make detailed videos about the differences, how you can get them. What if you don't do, like the timing? There are so many factors that go into that, but you have to have some form of US clinical experience. So when you apply, people can know that you have done something in the US. Each country has a different system. It's not like because US is better, we don't accept some rotations from somewhere else, because the system is different. So they want to know, are you accustomed to the system? Can you work in the system? Do you understand what you're getting into? Imagine yourself going in a job without even trying working here. Maybe you don't like it. So that's why they need some testimony from people who we work with in the US healthcare system. Second, which is not a hard thing, the personal statement. Who you are, what brought you into this field, into this country, what makes you stand out, why this program. So you need to write a personal statement, which takes a lot of time, because if you want to write a good one, you need to go through multiple drafts and so many drafts. So I recommend having at least somebody who's experienced with this look at it, because you by yourself might not see things that might be important to program directors. So that's number two. Number three is research. Research is not mandatory. There are a lot of applicants who match without research, and there are some applicants who do research and don't match. So it depends on what type of research, where, which institution, who's your mentor. You can get letters of recommendation from that, but it boosts your CV, definitely. If you have research, it will give you more value as an applicant. So research, not needed, but helps. Letters of recommendation required. You need to submit at least 3, maximum of 4 letters of recommendation. You need your personal statement. CV, ERAS makes your own CV, so they have like certain boxes, and you can just fill them in, and they will create a CV for you. And then you can apply to programs. Generally, the process costs around $25 to $30 each program you apply to. Most IMGs for internal medicine, they apply around 120 to 180 programs, 200 programs. So you can imagine with traveling and hotels. This year it was virtual, but previously it used to go in person. That cost around $5,000, just the traveling and the hotels. And depends on how many interviews. If you get 1 interview, it's going to cost you $500. If you got 10, it's going to cost you more. So it depends on how many interviews. So again, exams, certification, then these extra things that you need to do, and then you apply. After you apply, you wait for interviews, you go interview. Interviews are very important to match. These are the high. After you receive an interview, you have your foot in the door. You either increase your chances by being a good interviewee, or you screw your chances. You're done. If you say something very bad during an interview, even if you had 280s on your scores and you had a Nobel Prize, they will not take you. Because I wrote about that recently, that you have to be a good fit for the program. If you just good scores and stuff, you're gonna work with me for the next 3 years. I don't want to work with somebody I don't like. So that's important. Personality and understanding the culture, something that might be normal in your own country might not be acceptable here. So all these factors play into role. This is what I have to say. If you have any questions, let me know. You're muted, I think.
Okay, so we do have a lot of questions in the chat box, and they're still pouring in. Would you like to answer them now, or after you have said what you have to say?
We can answer them now.
Okay. Would you please take the questions, or should I be reading them out aloud?
I'll take them. So,
All right.
the first question is from Abdul Haseeb, and he's saying that, so is there no need to study that much for step 1 exam and to focus on clinical knowledge more if you're willing to appear for USMLE after January 2022?
I think you still need to study, not to the same amount. So, for example, now if I'm studying for my step one, if this super rare disease that I don't get see many times on New World and it's not that high yield, I'll just forget about it. I would not focus on it because it's gonna probably even if it comes, I'm willing to lose a few points for that. But the important things you have to focus on them. So the nitty details, forget about it. The things that you see appear more and more, you can focus more on.
Okay. So next question is from Laiba, and she's saying, so this procedure, should we do after our MBBS or we could do it during our 5 years of MBBS?
During, you can do everything that I'm talking about, you can do during. The research could be done after, but exams you can finish before.
Okay. So another question is, how did you finish all your requirements by order from USCE Step 1, Graduate, Step 2, CK, CS, and Research?
USMLE Step 1, clinical experience. Step 2, research, clinical experience applying.
Okay. Next, are there things that you think it would be good if I did in med school? What is your advice for first year medical students?
To study exams earlier. This is something I would have done if I went back in time. The thing is, so many students don't know if they're interested in the US or this is something they want to do. So that's a factor. But if you know that you want to come to the US, start early.
Okay. Zoha is asking, apart from scores, how can we stand out? And what is important to have on your CV for someone aiming for pediatrics?
Research is a good thing to stand out. Volunteering is if it's very cool, like you did. You help children who are homeless, and you went to volunteer in something very unique that nobody have done. If you're an Olympic player, I know this year when I was applying in plastic surgery, there was one applicant who was an Olympic medalist. She had the medal, and I looked at her name. She has a Wikipedia page in her name. She is the second person in U.S. history to have that medal. She got Stanford, I don't know how many championships. So something like that makes you stand out, something unique that not everybody has. Hobbies, if you have a unique hobby and you're a professional piano player or a volleyball player, violin, something unique, different what everybody has.
Okay. Next question. What are the advantages of being ECFMG certified without having electives globally in UK, Australia, and UAE?
There are some pathways to do. Once you're certified, which means you have your step one, step two. I think GMC announced recently that you can skip the PLABs if you have that. But honestly speaking, if I had the choice to go to one of these countries, I would definitely choose the US. So many people from the UK are coming to the US. I don't see this happening the other way around.
Okay. Who are the persons who you asked to write your letter of recommendations, and when or how did you ask for letter of recommendations during USCE? Was it at the time of USCE or at the time you were applying for ERAS?
At the time of the electives, you have to do it as soon as possible because if you do it later, they will forget about you. And you have to stay in contact. So you can ask them that I'm applying in a year or 2 or 3. Can you please write me the letter now? And later on, when I need it, you can upload it. They'll probably say yes. Keep in touch with them, update them about what you're doing so they don't feel that he only asked us for this letter and then he forget about it and 2 years later he's contacting us. That's not good. So update them about what you're doing and the people you work with who's going to write you your letters, the doctors you research with, elective with US clinical experience, so somebody who knows you.
Okay. Next question is, will medical school grades become more important since step 1 is becoming a pass or fail now?
For international graduates, I don't think so.
Okay.
For US graduates, maybe, but for international graduates, I don't think so.
Okay. Next question is, when is the exact time one should start preparing for step 1?
as soon as possible. So you start. There is a difference between start preparing and do the exam. Start preparing from day one of medical school. You can start preparing. Read question banks. And I did. I don't know if you know Santiago is one of the. Also, he has a good YouTube channel. And I did a YouTube video with him, and he started very early. He has a different experience, and I'll post that soon. How you can start with question banks. Read like what not with the purpose of doing the exam anytime soon. Just have this mentality of this USMLE goes in your mind and how to think. And then once you feel ready, you can do it. For step one, I definitely recommend having doing the exam at least after you finish your basic science year. So in the 6 year system, around year 3, mid year 4, don't do that before for that. At least after you finish pathology.
Okay. Next question. How did you get your research position? And what should we do to put on the email on the professors regarding asking for a research position, as they will be reading our emails in a very short time?
That is true. They will be reading your email in a very short time. So make it concise to the point. If you are reading, put yourself in their shoes. You're reading this email. How would you make it as short as possible to convey the information that you need so they don't skip reading it? So you have to put the purpose of the email very high. So if they want to know about it, they can read more, make spaces. I've helped several students like write these emails and do it for them. How to apply for the position, as you mentioned, emails are a good way, but you have to make it personalized. Don't just send the same email to everyone. Write their names. That's very important. You can't just say dear doctor or dear something. You have to write their names so they know that you personally know them and who they are.
Okay, so my question is that what would you recommend resource-wise? What should we move to if we want to prepare for the USMLE?
For step one and step two, I think UWorld is more than enough. Step two, UWorld is more than enough. You have a gap in certain things, you can fill it with certain books, like Step Up to Medicine, Master the Boards. But if you don't have gaps, start with UWorld directly, especially if you have prepared for step one first. If step one first, UWorld is more than enough. I got 272 on my step two without just UWorld by itself. So if I get that, you can get that, and everybody can get that. It's how you study and your testing skills rather than the material. So that's one. Step one, if you've studied these things very long time ago, like the anatomy, physiology, biochemistry, you need to do something about that. Like read Kaplan books quickly, but don't stay years studying that. Do that in like 2 or 3 months, very quick, while you're doing something else. Don't memorize them. Just use them as a resource to get some information, the basics, and then focus on UWorld or first aid. Ambos, I know some people are using Ambos a lot these days. I haven't tried that. I want to try the free trial just to see how the questions look like. Is it as good as UWorld? UWorld is phenomenal. It's a little bit more expensive, but it is amazing. Like, no way anything can come close to UWorld. So I want to try Ambos and see if it's as good.
Okay. What year of med school do you prefer we start studying for step one? And what?
Prepare, I think we answered the question.
Okay. Okay, last question. Sorry, we have a lot coming in. What do you recommend to do after med school? In which years of med school I can do electives? I will take USMLE exam in the end of second year.
So what to do after school? Come here as soon as possible. Do something here as soon as possible. Don't stay for years. Unless you have financial issues, that's a different issue. But if you can come here, do it here. Everything that you do here is more valuable than you do in your own country. Why? Because they want to know that you can work in the system. When you can do your electives, each school has different criteria. So look at the websites of the hospitals where you do electives at. The thing is, they want you to finish at least, I think if you're in a 4-year system, at least the third year rotations. So almost 75% of your school or rotations. So you know what you're doing when you come here. So if you're in the 6th year, probably you have to finish 5 years of your medical school before you come in. But you can come anytime during your 6th. So it has to be probably in the final year. So have everything ready. So because you only have very short time, you can't do it in your 2nd year, I think.
Okay. How did you get your letter of recommendations from someone in the US, especially when you're traveling there for the first time in your life and have no much needed exposure to people? Wouldn't it be useful to get letter of recommendations from tertiary healthcare centers of your own country, like Aga Khan and Shifa in Pakistan?
Nobody knows. They might know unless they're like from the person reviewing their application is from that country. Nobody's gonna know. Again, it's not because these places are small or not good. It's because they are. Can you imagine how many countries are out there? So many countries, so many hospitals. How would they know all these places? So that's the problem. Take your everything from the US, which means you have to come here. Some people tell me, "Oh, I don't have money," and like, this is how it works. The US journey is expensive. It's not like you come here and people will give you money. You have to invest in it. Some people work before they do that. Some people have their family support them. So you have to find your way. But the system is expensive. Applying to the match itself might cost you around $15,000.
Okay. Do you have any advice on optimizing our chances to secure electives in the US?
Having a good score on step one, if it was before pass fail, having a good CV, letters of recommendation from your own country here for the elective, research, volunteering, show them that you're a good applicant.
Okay. There was a decrease in IMG's matching ratio this year too. So what things should an IMG keep in mind to outshine US local med students in step one score being out of the equation now?
Other stuff, which means it's gonna be more costly. The electives it's more expensive to do electives and research than to study for step one. Step one, you can study from the comfort of your own home, it's free. Well, if you have to come here every month, you spend in the US will probably cost you around $1,000. So I think it's gonna be more costly to US students, to IMGs to be on the same level of US students.
How many letter of recommendations you submitted? What were they all from research? If not, how many from research and how many from USCE?
Research, 2 or 3 out of 4. It depends. Because you can assign different ones. So some institutions I gave 2 clinical, 2 research. Sorry, and some institutions 3 research, 1 clinical.
Is doing residency in home country increase our chances to match?
Not necessarily. Sometimes no. So it depends.
Okay. Aisha's asking, what are the common mistakes that applicants make when writing their personal statement, and what to write in first few lines of personal statement?
Usually I start with a story. I tell a story of what brought me to this, or some of my challenges, or a scene I remember of a patient, and then I start with the why the specialty, or why me, the strength of my application. But you have to be very humble about that. Again, there are 3 videos I discussed that in detail about the personal statement.
Okay. What is the first thing you did after you graduated from med school?
First thing, it was research. After before graduation, it was electives. After med school, it's research.
Okay. Can we apply after doing our house job in our country?
Yeah.
Okay. Beth is asking, why is USMLE conducting body making these changes? Step 1 being pass or fail, and step 2 CS being cancelled. Like, what are the main reasons behind it?
So when they met, they said that USMLE step 1 was creating some stress on medical students, and it led to decreased diversity because they found some races and certain groups are getting lower scores than other groups. So to solve this problem, they decided to cancel the exam.
Okay. So, what other sources for step 1 do you recommend? What authors, specific books of certain authors and question banks do you recommend?
So I prepared Kaplan mainly. Also, Patoma is good. I like First is the New World. These are the Bibles, or whatever you call them, for step 1. The first aid is the review book. You have to be careful that it's a very detailed. It doesn't have the explanation. So when you read it, you might get frustrated. You feel the frustration that you're not understanding. And the exam is all about understanding. So that's why you need to supplement it with either your prior knowledge from your school, your understanding from the books you read, like Kaplan books or Pathoma, or from your work.
Okay. Next question. How to optimize the observership experiences and stand out without being able to do anything hands-on?
That is very difficult. That's why I don't like observerships, because it's very hard to stand out. What you can do is read about the topics, ask them to ask you questions, be prepared in case they want to ask something. Also, you can do a presentation. This is something I did. I asked them to do a presentation at the end of the case, and they were, wow, this is a very complicated topic, and you were able to give a presentation about that. So stuff like that. Let's take two more questions because I have something at 11:45.
Okay. In 2022, when people with a pass-fail score applying along with those who had a score back then, would only the step 2 be viewed, keeping in mind all other criteria like research and electives are on par?
So let's say you have 260 on your step 1, and the same person the similar person had pass fail because they applied after, and you applied at the same time. Your score will still be 260. They will not hide your score, and that person will be pass fail. If program directors will say, you know what, I'm not gonna look at the 260 because everybody is pass fail, I don't think that will happen. They might glance at it. They might look at your score. And if you had a high score, you might be advantaged. If you not, you might not. Some committees might say, you know what, we're gonna block all the scores. The coordinators will block the scores. We will not see the scores. But USMLE will give programs a score. So if you have a score, it will be kept for 100 years from now.
Okay. So last question is, do you get enough reward which is worth your so much effort, especially if we talk about financial rewards?
After residency, you mean?
Do you get rewards after so much efforts and work that you've done, especially talking about financial rewards?
Yeah, so yeah, they answered yes. So after residency, it depends on what type of rewards are you looking for. If your goal is to get money, maybe you've chosen the wrong specialty or wrong profession, because there are way more other professions that you can get way more money with the similar amount of intelligence that medical students have and effort they put. So if the ultimate goal is money, you will get a lot of money in the US. It's definitely the country with the highest salary, no comparison to anywhere else. No doubt. Like this is, I have no doubt about that. It's the highest salary of all countries around the world. So you'll get a lot of money. But the thing is, are you coming to the US because of money? It's up to you. You have to decide whether this is the reason. But there are so much potential and opportunities in the US that people just come for research or the great education or so many other things that makes the US stand out. But the money is a lot after residency.
All right, if I'm not interrupting you,
Oh,
because we're
I have a
running
question.
out of time, I would like all of you to type in the feedback in the chat, and I'll be sharing the links to the channels of Dr. Asad here in the description below. And for now, I would like to request you guys to please turn on your cameras so that we can take a little picture and just for a memory of the activity that we had. If majority of you are comfortable with that. Now, can you please let me know when you have taken the picture?
Alright, we're done with the picture. If anyone still wants to
Thank you so much.
Thank you for having me.
Thank you so much, sir. It was an honor.
Thank you. You can leave the links and you'll see more useful videos coming out. Have a great day, everyone. Bye bye.
Thank you. Thank you so much, sir.
Thank you so much, sir.
If you guys have typed in your feedbacks, you may say bye and leave. And we're leaving the links in the description below. Thank you so much for being here. I hope that this session was productive, and I hope that we would be doing greater things in the future, inshallah. If anyone has to say something or send in feedback, do it in the chat box. Okay, thank you so much. Thank you, Laiba.